trying to fix Obamacare is like trying to pick up a dog turd from the clean end. You know, it just doesn't work. Okay. The whole thing is based on failed principles of economics, and it can't be fixed. It needs to be taken down, and we need to have reasonable things. Restoration of free market principles, making insurance again, making medical care the product, restoring the doctor-patient relationship. If the government can successfully legislate happiness, then maybe the government can fix something. They can't do it, okay? The government has never, will never be able to fix it. The free market can fix health care, but again, there's a lot of things that we need to do. Now, the other thing I wanted to see is if there's any questions, because I do a lot of these talks and I always have questions. So, do we have time to just open it up for a few questions? You want to do that? Okay. Sure. Does anybody have any questions for either of us?
Can I ask what you feel about pre-existing conditions?
Okay, good question. Very good question. There's two different kinds of people. Some people that have pre-existing conditions through no fault of their own, they're uninsured through no fault of their own, and I think we need to do a lot for those people. There's some people that have chosen to be uninsured, and then they develop something, and then they can't get insurance. So there's two different categories. And if it's through no fault of their own, like a child that's born with a defect, I think we need to have something that works for that. Many states have a high-risk pool that functions pretty well, that's subsidized by the insurance companies. They have, one little high-risk pool. I think that that's a very effective reform. If medical care were the product and it were more affordable, then the health insurance that covers it would be more affordable too. I know though that here's what I know about pre-existing conditions. Starting 2014, when health insurance is guaranteed issue for everybody, no health questions asked, okay? Everybody gets the same thing. And the difference in price between a 20-year-old and a 64-year-old can be no more than 300%. Right now it's sometimes 800%, okay? Modified community rating. When that happens, the young ones are gonna say, my premiums have shot through the roof. It's guaranteed issue. I'm going to drop it until I need it because they can't discriminate. Okay, so that's the bad part about what they tried to do. Okay, I think we do need to do something. I think there's a lot can be done. Does that?
Can I say something?
Yeah, sure.
Yeah, I want to say something about that. You know what happened is, and this, you correct me if I'm wrong, but this is the way I put this together. If, in the old days when you were responsible for your own health and your own health insurance, you bought your insurance when you were 20 years old, it was low cost, and although the cost may go up some over the years, you carried it with you, it was belonged to you, you're the customer, it was totally portable, you didn't need a patient bill of rights. I mean, it was your insurance, just like your car insurance, okay? But the problem is that when we made the employer the customer, now your insurance is linked to your job. And so if you get fired and you're 55, you're stuck. And if you don't own the insurance, it wouldn't happen. So it is a problem, but it's a problem we created with this employee-run health insurance. And honestly, employee-run health insurance is one of the great evils that's brought us where we are today.
Yes, ma'am.
Okay? I mean, and I'll tell you, I was in business. I had 7 employees. And in my 7 employees, we were trying to figure out what to do. And what I discovered years ago was that I could, if they bought this insurance on their own, it was half the cost of me buying it for them. And so what happened was, but I could not give them the money to do that. This is kind of a funny story. It's illegal for me to say, I'm going to increase your salary a little bit, you go buy the health. Here's the money to buy the health insurance, you go buy it. That's illegal. But what I could do is give them a bonus. So I decided to, every year, I would just give them the bonus at the front of the year, and they could go out and say, I'm not telling you what to do with it, I can't tell you what to do with your bonus, but I'm not going to give you health insurance anymore as part of your contract. So here's a bonus going to you, you figure it out what you want to do. Okay. 6 of my 7 employees, they went out and they got health insurance, and the other one went on state Medicaid and took the money and ran. So then I said, oh, well, this is not a good idea. So then I said, how am I going to deal with this? I said, okay, we're going to rewrite the employee contract one more time. We're going to give a good citizenship bonus on the first of the year, and if you're registered to vote, if you come to work all the time, you're a good employee. If you're not on any government assistance, we'll give you a good citizenship bonus for being a good American. And that's what I did. So you couldn't be on Access and take that good citizenship bonus. That's how I got around it. That's what I did. And it's honestly cost effective. You know, it's amazing to me when I talk to like a 25-year-old in the emergency room who just got busted up on his motorcycle and I say he has no insurance. He bought a $6,000 motorcycle, but he has no insurance because he's been told by the news media that insurance is really, really expensive. But I can tell you, Ralph helped me, that you can get insurance policies if you're a young guy for not very much money. Like I said, my son, who's in perfect health, no smoking and everything, but he pays, you know, $40, $45 a month for his health insurance, which really isn't outrageous.
How do you know where cash doctors are?
That's a good question, and usually there's somebody around that knows, but what I have said to the AAPS is that we need to be a clearinghouse for that. So in the future, I hope that we will have a list. You know, I know in Omaha you can find some. We had people in here, you can go to MediBid, that's right. MediBid has cash doctors, I should have told you that, medibid.com. They're a clearinghouse for one, but you can find cash doctors around. And honestly, here's the other thing people don't realize. If you're Medicare, you've lost your rights to pay cash to people that are not opted out of Medicare. But for the rest of us, if you have a high deductible, you're allowed to pay cash. And when you go see a physician, or you're going for an MRI, or a hospital, for something that's in your deductible range, because I had these guys that were farmers out in Arizona, they got a $10,000 deductible, and we cut them a good deal. And they should cut, and you can go to cash labs, like LabCorp specializes in cash labs. Our hospital at Stewart Memorial set up a wellness panel, so you could just walk in and get really good blood study panel to really check wellness and pay cash for it, and it's lower than, you know, you don't have to go through the doctor's office, you just do it yourself. And you can get a doctor, you know, you can then take it to your doctor, but you don't have to have a doctor to order it, it's a wellness panel. So it's kind of a nice concept. So I think it's going to become more easy to do. Did I answer your question? Kind of. But aapsonline.org, you can reach me through that, and you can find out information about cash doctors. And I think if you really want to know about cash doctors in your area, even though we don't have a thing right now, we're going to have a list, but they can tell you somebody. And just asking around, you know, I found people just asking around. All right. Thank you very much for coming. This says people want to know how to reach me, and I just told them AAPS. What's that? Oh.
No, one of the big pushes, what ideally would be the government's role, if any, for uninsured or the truly poor?
Well, I honestly, I don't think anything. You know, if you go to aapsonline.org, you will find Alita Eck. She and her husband are both physicians. They do a free clinic in New Jersey. They see people much more. It costs them $5 a patient. They see people very efficiently. It's church sponsored to some degree, but they get volunteers. Their patients are very grateful and they come and volunteer, the indigent people that they've helped. And it's the way we used to do charitable medicine. I mean, what did we used to do? It was your family, it was your friends, it was, Samaritan Ministries.